Okay, let me go ahead and start by doing an introduction. And I speak louder, so maybe you should talk and I'll translate and amp it up. But I know a lot of you. I'm Georgia Milan, and I'm a family practice doctor. And the reason that Dr. Lockwood is here is that a lot of us doctors have been very concerned about environmental issues because so many human health issues are caused by the degraded environment. So every year, St. Patrick's has a Turning the Tide conference, and that's Shank. You should stand up and take a bow. She's a real driving force because Beth not only has great ideas, but she manifests them. Okay, I have great ideas, but my ability to manifest is much less than Beth's. But us doctors have really been, and not just doctors, but other healthcare professionals, have really been called upon by our organizations like the American Medical Association, my Academy of Family Practice, the World Health Organization, to stop just being in the exam rooms, diagnosing and treating, but to really start looking at the true cause of disease and really look at prevention. So we have been looking at environmental problems. This year, the Turning the Tide was about climate change. And within climate change, as you all know, coal is a very large contributor to climate change. In fact, 43% of all the CO2 globally is coming from coal. But we were looking at the issue of coal as Montanans because there is so much medical evidence now published about the harmful effects of coal, from the mining of it, to the burning of it, to the transportation of it, to the climate change, to the coal ash waste from burning the coal. And there is so much data on it that Dr. Lockwood wrote a brilliant book compiling the epidemiology called The Silent Epidemic, the hidden health effects of coal. And we say hidden health effects because we switch on a light switch and we have light and we don't see the damage that's being caused because 43% of our electricity is generated by coal. And so we really want to look at this coal issue because as Montanans, we're like the Saudi Arabia of coal, right? I mean, we're sitting on 1.5 billion tons of coal. And we've already gone very far down that road of releasing that coal. Some of this coal is used to produce electricity for us and others. As you know, the market for coal is really declining in the United States because it's a dirty industry, but it's not declining yet in Asia. And so we're looking at mining a lot of our coal from Montana and shipping it to Asian markets. And it's of a big concern to us because of the human health impacts of mining the coal, transporting the coal, and then the pollutants, as well as the heavy metals like mercury, will be returning to the Pacific Northwest in 4 to 5 days. And then the elephant in the room, which is climate change. And truly, our coal may be the time bomb that really pushes us over the tipping point. And we as Montanans have some very big decisions to make. A lot of decisions already have been made for us without our input. We probably have maybe a year before that coal is being mined to ship to Asia. We met with a lot of people at the Capitol yesterday, and they informed us that there's not really a human health impact statement that is going to be done, that they do have environmental impact statements, but they really are prepared to do human health impact statements, and yet the Constitution of Montana talks about a clean and healthy environment for the citizens of Montana. So how come we're not looking at the human health impact? And not only for coal, but other things. And we really need to stand up right now because everyone we met at the Capitol, including our federal senators, are saying, well, we just need to hear from the people. And it's interesting because a lot of these people want to do what as doctors consider the right thing, but they don't quite know how to do that without a lot of public support. And so we were very, very lucky to have Dr. Lockwood come again. If you haven't read his book, Dr. Lockwood has been the president of Physicians for Social Responsibility, has been with them for 30 years. He's an emeritus professor at the University of Buffalo Neurology and Nuclear Medicine. He has published over 220 articles. This particular book was published by MIT Press, and you all probably know that with MIT Press, it has to be doubly peer-reviewed. So the facts in here are phenomenal. And we're very lucky to have Dr. Lockwood here tonight. While he is speaking, if you all don't mind, we are going to pass around, this is a petition from the American Lung Association, and it's to support the Clean Air Act, so people feel like signing it. That would be very helpful. We want to thank EVST here at the university. They're always extremely helpful to us, and we're able to get this room, and we work a lot in partnership with them. And I thank all of you for coming to get the facts, because it's so easy to not get the facts or to pretend none of this is happening, and to take this time and be here is, I'm very grateful. So Dr. Lockwood, thank you.
Well, thank you very much, Dr. Ma, and I will do my very best to speak as loudly as I can, but as she said, I'm at the end of actually about 10 days of a speaking tour, and I need an otolaryngologist. So I'm going to be talking to you this evening about clean air and health, which is the subject matter of the book that Dr. Milan met. And here's what I'm going to be talking to you about in some detail. I'm going to define what it is that we mean by health, which may not be completely obvious to all of you, because the World Health Organization has a much broader definition than what you might be thinking of. And then talk about health in the coal life cycle, starting with the mine and then moving through burning coal, where the major problems arise, and talk a bit about coal ash disposal. Talk about the pollutants that are generated by burning coal, and spend a bit of time talking about some of the evidence that links these specific pollutants to the 4 leading causes of death in the United States. And those are cardiovascular disease, malignant neoplasms, that is to say cancers, and not just lung cancer, respiratory diseases, and finally stroke. Oops. Then I'll say a bit about global warming, and then conclude with some information about what the real costs of energy are in terms of healthcare and healthcare economics that are associated with the choices that we make for the energy that we use. Now, this is the definition of health that's been put forth by the World Health Organization, and the WHO says that health is a state of complete physical, mental, and social well-being, and sometimes we lose sight of that mental and social well-being, and not merely the absence of disease or infirmity. It's all too easy to talk about diseases and infirmity, because those are kinds of things that we can diagnose with great accuracy in our office, and they wind up in healthcare statistics and databases that we use for making some of the inferences that link air pollution, particularly that comes from burning coal, to various health conditions. So why coal? Well, coal is an important source of energy that we use for generating electricity in the United States. These numbers are changing relatively rapidly, but at the present time, somewhere around 43% of all the energy that we use for generating electricity in the United States comes from burning coal. And I hope to persuade you this evening that is possibly the worst choice that we could be making as an energy source in terms of things that relate to health. Now, this slide illustrates some of the very first linkages between coal and death, serious illnesses, and minor illnesses, and was published in The Lancet in about 2007. And these investigators looked at data that were obtained in Europe, and found that somewhere between 20 and 30 people die for each terawatt of electricity that's generated and consumed. And to put that in some kind of perspective that pertains to the United States, we use about 4,000 terawatts of electricity per year in this country. So if you multiply those numbers up there in the first 2 rows for lignite and other coals, you can rapidly come to the conclusion that burning coal is responsible for a large number of deaths, serious illnesses, and minor illnesses. In fact, I would contend that if we were to write down exposure to coal-derived pollutants on death certificates, that that cause of death would be among the top 10 causes of death in the United States. But we don't do that. Now, coal mining is a dangerous occupation, as almost surely everyone in the room recognizes. And in 1969, the federal government, because of the large numbers of what's referred to as black lung disease, and in the medical literature it's referred to as Coalworkers Pneumoconiosis, because of the high prevalence of this progressive, occasionally or often fatal disease among coal miners, federal regulations were established that sought to make the mining workplace safer. And as a result of that, the prevalence of coal workers' pneumoconiosis, or black lung disease, began to decline in the 70s and the 80s. But in the 1990s and after the turn of the century, particularly in the smallest mines, that is, those that employ fewer than 50 individuals, as shown by the red bar in this graph, the prevalence of this disease began to increase. And the explanation for that has been put forth in the literature, is that there's been a progressive disregard of the regulations that were promulgated in 1969. Now, one need be a coal miner to experience some of the adverse health effects of coal mining itself. And some of this is probably pertinent to those of you who live here in Montana who face the possibility of very large numbers of trains laden with coal making their way from the Powder River Basin to possible transshipment sites in the Pacific Northwest. These investigators from the University of West Virginia surveyed the occupants of West Virginia and divided them into two categories. Those who lived in counties where 4 million tons of coal were mined per year, and those who lived in counties where less than 4 million tons of coal were mined per year. And it was clear from this epidemiological study, which was published in the American Journal of Public Health, which is the most rigorously peer-reviewed public health journal that there is, found that with progressive increases in exposure to coal mining, the prevalence of a number of diseases increased fairly substantially. And the exemplar that's shown in the bottom portion of the slide shows that chronic obstructive pulmonary disease, that is to say emphysema and chronic bronchitis, is about 50% more prevalent if you live in a county where more than 4 million tons of coal is mined per year. Now, about 70% of all of the coal that's mined in the United States is transported by rail. I'm sorry, I didn't say that quite right. About 70% of all rail traffic is accounted for by moving coal from the mine site to a power plant. And rail accidents are much more prevalent per ton mile than road accidents, although we don't see the evidence of train accidents in front of us the way we do with road accidents. And in addition to the accidents themselves, which by and large are responsible for substantial amounts of morbidity and mortality, but the diesel engines that power the locomotives and trucks that move coal also emit small particles, which is, I will explain in the next portion of the presentation, are responsible for substantial amounts of disease and death among the American population. So it's, in addition, the road dust that's churned up by the trucks that drive on the roads that cause wear and tear also produce these small particles, which inhaled deeply into the lung are responsible for the production of triggering pathophysiological processes that affect not just the lungs, but also the heart, blood vessels, and other body organs, causing a variety of diseases. And this is an example of one of these railroad accidents that took place last summer. This accident killed 2 young women who happened to be standing too close to the tracks when this coal train derailed, and they died as a result of that. And this is not a rare phenomenon. Now, where the rubber hits the road, so to speak, is when coal is burned. And the Environmental Protection Agency surveyed a number of coal-fired power plants in the 1990s and determined that over 60 hazardous air pollutants came out of the stacks of these coal plants. And the reason for that is that coal is not just a simple mineral that is composed exclusively of carbon. It's actually a very complex collection of minerals. Carbon is the chief component of coal, and when it's burned, it produces heat, and that generates steam and is used to generate electricity. But amidst the carbon are a host of other elements and compounds that are released into the environment when this coal is burned. So things like arsenic, cadmium, chromium, particularly mercury, and I'll spend a fair amount of time talking about mercury because of its effects on the developing brain. Nickel, acids like hydrochloric acid, hydrofluoric acid are also released into the environment, along with small amounts of uranium and thorium, which are radioactive elements. So the emissions from coal-fired power plants are very complex. Now, when the Environmental Protection Agency was established in 1970 during the administration of Richard Nixon, it was charged with protecting human health and the environment. And as a part of that process, EPA identified 6 pollutants which are referred to collectively as the criteria pollutants. And these are the ones that are judged to be the most dangerous to human health and the environment. And importantly, EPA has established national ambient air quality standards, or so-called NAAQS, for each of these 6 ambient criteria pollutants. And the ones that I'll be talking about tonight are oxides of sulfur and nitrogen, ozone, sulfur dioxide, and particulates. And I'll also be talking a bit about mercury, as I said before. Now, each year in the United States, we burn about 1 billion tons of coal. And that produces an enormous waste stream. In fact, there's about 100 million tons of ash that's the leftover after the coal is burned and has to be disposed of. Now, one of the ironies in this whole business is the fact that as pollution control devices, as mandated by EPA and state and other authorities, become more efficient at trapping these pollutants that would otherwise go up into the atmosphere where we would inhale them, the ash that's left over becomes more and more toxic. And there are communities all across the United States now where the heavy metals, particularly arsenic, that's trapped in this coal ash, is seeping into community water supplies, making them undrinkable. This is an example of what can happen at one of these coal plants when these containment ponds fail. This is an aerial photograph of the Kingston, Tennessee Valley Authority power plant. And in December of 2008, a dam that was holding back a lake that was 84 acres in size. And behind this, in this lake, were over 1 billion gallons of a slurry composed of water and coal ash. Well, on that morning, that dam failed, and it released over 1 billion gallons of this slurry into 2 adjacent rivers that form the water supply of communities that are downstream. And it caused a horrendous amount of damage environmentally and to the water supplies of these communities. And as I mentioned before, arsenic is seeping into groundwater supplies in many of these other repositories. Last summer, I visited a community that's around one of these ash disposal sites called Little Blue Run Lake. And when Little Blue Run Lake was established in the 1970s, it was billed by the coal company as being a boater's paradise. You could come and you could go boating on the azure blue waters of Little Blue Run Lake, just like you were in the Mediterranean. Well, if you were to go to Little Blue Run Lake, you would see quite a different story now. First of all, you couldn't get to it because it's surrounded by barbed wire fences and nobody's doing any boating there. And the water is blue because of all of the copper sulfate that's dissolved in the water as a result of the copper and other pollutants that are in the coal ash that's in the lake. Not only that, but the water from that lake is seeping into the groundwater and coming to the surface at the homes of the people who live around it. And I saw a street where a number of people had hoped to live for the rest of their lives, but are being forced out of their homes because as much as 750 gallons of water per minute were seeping out of the Little Blue Run Lake into their front yards. So this is an environmental disaster for these people, and this is a kind of scenario that's being repeated across the country in many places. Now, as I mentioned before, I think that the pollutants that are of the type that are produced by burning coal can be linked to the 4 leading causes of death in the United States. And these are in order: cardiovascular disease, malignant neoplasms, that is to say cancer and not just cancer of the lung, diseases of the respiratory system like asthma, chronic obstructive pulmonary disease, chronic bronchitis, and lung cancer. And the 4th leading cause of death is stroke, which I'm particularly interested in because, as you heard in the introduction, I'm a neurologist and I've seen way too many stroke patients during my career as a physician. Now, I mentioned the ambient air quality standards earlier that are established for each of the 6 criteria pollutants. And these are the most recently available data from EPA that show that approximately 1/3 of all Americans live in counties where these ambient air quality standards are not met at some time during the course of a year. And these are referred to as non-attainment areas. Now, since 2007, which is the year that's shown here, the ambient air quality standard for particulate matter has been lowered from 15 to 12 micrograms per cubic meter. And it's almost certain that the ozone standard will be lowered at the next opportunity that EPA has to do that. So 1/3 of the people in the United States already live in areas that are non-attainment areas, and the standards are becoming more rigorous. And they're becoming more rigorous because the Clean Air Act requires EPA to make periodic revisions of these ambient air quality standards as more and more healthcare information comes to bear on their regulatory activities. Now, this is a figure from one of the first studies that began to show how much burning coal is really costing us. Now, all of you get a bill in the mail or electronically every month, and you pay it, and that's what you think the cost of the electricity is that you're using in your home. But that's only part of the story, because there are significant external costs to burning coal that are not reflected in the power bills that you're paying, but are reflected in your taxes that pays for Medicare and Medicaid patients, in your insurance bills that you either pay yourselves or you pay in conjunction with your employer, that pay for the health care costs that are associated with taking care of the diseases that are responsible, that are caused by burning coal. And this report from the National Academy of Sciences shows that somewhere on the order of $62 billion per year in external costs attributable to healthcare expenditures are caused by burning coal. Now, most people now think that this is a low-ball estimate and underestimates these true external costs, and I'll revisit this a bit later in the presentation, that underestimates these external costs by a factor of between 3 and 5. So that the typical coal-fired power plant produces at least $150 million a year in external costs that are attributable to the healthcare problems associated with their emissions. Now, where do these criteria pollutants come from? Well, they don't all come from coal, but coal is certainly a major player. And this slide illustrates the origin of oxides of nitrogen. Generating electricity is the 3rd leading cause. Other fossil fuel combustion, such as cement kilns, where they make Portland cement that goes into concrete, typically uses coal as a fuel. And oxides of nitrogen are important in and of themselves because they're toxic and irritants. But in the presence of sunlight and the volatile organic compounds that occur due to human activity and natural sources in the air, these oxides of nitrogen are converted into ground-level ozone, which is also a pulmonary irritant and also one of the criteria pollutants, and the one that's responsible for the largest number of people who live in non-attainment areas in the United States. Burning coal is clearly the most important source of oxides of sulfur. It's also an irritating gas, forms sulfuric acid and other acids in the atmosphere. But perhaps more importantly, it's a very chemically reactive molecule, and it combines with other constituents in the atmosphere to form small particles, particularly those that are 2.5 millionths of a meter in diameter. And those are particularly injurious to health, perhaps in a counterintuitive way, because the smaller they are, the more deeply they go into the lungs when you inhale air. And the deeper they go into the lungs, the more likely they are to stimulate inflammation and other pathophysiological processes that are responsible for producing disease, not just in the lung, but in other diseases throughout the body. Small particles have generation of electricity as the fourth leading source, but also other industrial activities, some of which rely on burning coal, also make major contributions. Now, EPA and other state agencies monitor air quality throughout the country on a more or less continuous basis. But more recently, it's been possible to start measuring some of these pollutants from satellites. And this is the result of one of these endeavors, showing a map of the United States and parts of Canada that show the concentration of these very small particles using this new satellite technology. And using satellite technology, if I were to show you a map of the entire world, of course you would see China and India and other places that burn even more coal under less stringent conditions than imposed in the United States, have even larger amounts of small particle pollution. Now let me talk just a bit about the linkages between these small particles and various diseases, particularly cardiopulmonary disease. And two of the studies that are really among the initial and the most important studies are the so-called Harvard Six Cities study, in which the investigators found a 26% increase in all-cause mortality in the most polluted city compared to the least polluted city, and the American Cancer Society Cancer Prevention Study, which had similar results. And these studies have been replicated by others in Europe and other countries. So that's one of the important criteria in science as to whether or not something is valid, is whether somebody else does something similar and replicates and gets essentially the same answer, or one that's complementary. Other studies show increases in the rates of myocardial infarction and other diseases that can be linked to small particle concentration, and I'll return to that in a moment. Now, air pollution is also a risk factor for stroke, as shown in studies that have been done in Taiwan and Korea, again attesting to the international nature of the problem, and also the Women's Health Initiative. And let me just focus on that very important study for just a moment, because it's extremely important because of the way it was done and the size of the cohort of individuals that was enrolled in the study. These investigators, working at many medical centers throughout the United States, enrolled over 60,000 postmenopausal women who were judged at the time of enrollment to be free of cardiopulmonary disease. And then they were followed for an average of 5 to 7 years and seen back by these investigators periodically to determine whether or not, in fact, they had developed cardiopulmonary disease. And the investigators of the Women's Health Initiative's study found that for a 10 microgram per cubic meter increase in the concentration of these small particles, there was a 24% increase in the risk of developing a cardiovascular endpoint, which included a myocardial infarct, a stroke, or the need to have coronary artery bypass graft surgery. So these are not trivial endpoints. Now, using contemporary statistical and epidemiological techniques, it's recently become possible to link transient blips in the concentration of pollutants, such as small particles, with the time of onset of a variety of medical conditions. And this illustrates the case for stroke. So as I mentioned before, throughout the United States, there are these air pollution monitoring sites that give a time-stamped concentration of small particles operating basically 24/7. A lot of illnesses have a defined onset, and stroke is one of those where that determination is particularly important because critical therapeutic decisions depend upon the interval between the onset of a stroke and the administration of, for example, the clot buster drugs. And epidemiologists merging these two data sets, hospital records that show the time of onset of a stroke and EPA records that show blips in the concentration of small particles, it's been found that if there is one of those blips occurs, approximately 12 to 14 hours later, the risk of having a stroke increases by about 10%. And similar studies have been done linking the time onset of implanted cardiac defibrillators. Now, does anyone in the audience have one of those devices implanted in them? There's often someone who does. A couple of nights ago, there was a gentleman who did. When those things go off, it produces an electric shock that restarts the heart in an appropriate rhythm, but it's also very painful, so that you can't miss when that happens. In fact, it's so painful that some people have asked to have those devices removed from them because they don't want to have it happen a second time or a third time. So when that happens, you go to the emergency room, and technicians put little radio transmitters and receivers over the device, and they can talk to it and extract the exact time that the device fired off and a sample of the electrocardiogram that shows the exact cardiac rhythm that caused the device to operate as it's supposed to. So that forms a time-stamped time of onset of a potentially fatal heart rhythm, and then the epidemiologists combine that with the time-stamped information about pollution. So this is another way that epidemiologists have been able to make the link between specific disease conditions and specific pollutants. This is another slide that shows a link between cardiovascular disease, heart rhythm disturbances, and hospital admissions for congestive heart failure and increases in the small particle concentration. Now let me turn now briefly to a discussion of problems associated with mercury. Mercury is a naturally occurring element, and there are small amounts of mercury in coal, and when this coal is burned, this mercury goes up into the atmosphere and causes problems when it comes back to Earth. And this is a map that shows the rate of mercury deposition in the Northern Hemisphere from a UN study that was published in 2008, the Global Mercury Assessment. So as you can see, in the eastern part of the United States, where the most and the oldest coal-fired power plants are located, Eastern Europe, China, India, the major sites where coal is burned are also the sites where mercury deposition occurs at the highest rates. But as was implied in the introduction by Dr. Milan, that's not the end of the story. Some of this mercury goes high into the atmosphere, is caught up by winds that blow from west to east, and this figure shows a computer simulation of a plume of mercury that arises in eastern Asia and travels across the North Pacific to the Pacific Northwest parts of the United States and New England. So it's not just a problem for those who live nearby, but it's a problem of basically for everyone. And of course, carbon dioxide doesn't come back to Earth readily. It goes all over, particularly in the Northern Hemisphere. Now, when mercury comes out of the smokestack, it comes out as mercury compounds and as elemental mercury, and that gets trapped in small droplets of water that coalesce into raindrops, falls to the earth, and the water collects in waterways. And at the bottoms of these waterways are bacteria that convert this mercury into methyl mercury, an organic compound. And methyl mercury is very, very toxic to the nervous system, and it has the ability to cross cell membranes easily, and once inside of cells, it basically stays there for the lifetime of the individual. So it is persistent and it bioaccumulates. And this slide shows this pathway or this evidence for this bioaccumulation. The vertical axis shows the concentration of methyl mercury, and it's a logarithmic scale, so that the top illustrates a million-fold increase in the concentration of methyl mercury. And when you compare the concentration of methyl mercury in water to the concentration that's found in loons, which are large fish-eating birds that are found in northeastern lakes, the concentration is approximately 1 million times greater in the loons than it is in the water in which they live. So one of the take-home messages that's pretty easy from tonight is don't eat a loon, right? But you also need to be cautious about eating fish that are at the top of the food chain. And it's my understanding there are at least 30 lakes and waterways in Montana where there are fish consumption advisories warning particularly women of childbearing age and children to avoid consuming fish from those waterways in excess of a certain amount. Now, mercury, as I indicated, is a neurotoxin, and it interferes with the development of the normal brain. And there have been several really well done prospective studies that have looked at this problem in great detail. And one of those was done in the Faroe Islands, which is a small island where Nordic peoples live. There are about 40,000 of them, and they don't go anywhere. Once you're born in the Faroe Islands, you tend to stay in the Faroe Islands. And the investigators that did this study went to the islands, and they measured the mercury concentration in the cord blood or hair from 1,000 consecutive live births of single babies. So they excluded twins and triplets, basically. And then they went back periodically and gave neuropsychological tests to these kids as they grew up. And by the time they were 7 years of age, the children who had the highest mercury levels had definable abnormalities of clinical significance in cognitive function related to memory, attention, and language function, really fundamental aspects of cognitive function and what we recognize as normal brain function that makes us the kinds of people and individuals that we are. And it was on the basis of this study that EPA, acting on the advice of the National Academy of Sciences, established what is referred to as the reference dose for mercury, which is the dose that's thought to be free of substantial adverse effects. But these investigators, like almost all investigators that have looked at these pollutants, have failed to show what in the literature is referred to as a no adverse effect level, or a NOEL. So a NOEL means if it's below that level, there's no adverse effect associated with it. There's also something, a no adverse effect level. So for each of these pollutants, there's no level that can be shown to be demonstrably safe. And in the case of mercury, there are no metabolic pathways or enzymes in the body that require the presence of mercury in order to be able to function. So any mercury that's there is apt to be a troublemaker. Now let me switch gears here and talk a bit about global warming. We heard a bit about that in the introduction. It's real, and I'll show you data from 4 different studies that say that that's in fact the case. Is it caused by human activity? And there are many lines of evidence that show that that is the case. And I'll show you some of the details of that, and would be happy to answer questions, particularly about this isotopic carbon-12, carbon-13 ratio, which I think is particularly intriguing. Oops. And of course, there are going to be adverse health effects, and there are already adverse health effects that are associated with global warming. And these include heat-related illnesses, drought and starvation, increases in sea level that are due to warming of the ocean, which has caused expansion of the water that's in the ocean already, plus melting of polar ice caps that's making that problem even worse. In addition, a variety of diseases like malaria, dengue, West Nile virus, and others are likely to become more prevalent. Dengue was practically unheard of in the United States, but now there are beginning to be cases in southern Florida. And when I was in Argentina a couple of years ago, all throughout the airports were signs asking people to be sure to drain water, standing water, where these mosquitoes breed. And this year that just ended was one of the worst years in terms of the number of cases of West Nile virus on record. A lot of plants grow better in high CO2 environments, including ragweed, which produces pollen, which is an allergen. Poison ivy is another one of those plants that's going to grow better in a high carbon dioxide environment. And finally, severe weather events are likely to become more prevalent. Now, this is the Keeling Curve, which as a research scientist, I'm particularly intrigued by this. Now, the first Professor Keeling saw as his life's work the ability to measure carbon dioxide accurately and sequentially in atmospheric samples. And he set up his laboratory on Mauna Loa Observatory in Hawaii. If I'd given a chance to work in Hawaii, I might choose that also. But that's where Professor Keeling began his work, which continues to the present time. And in 1990, he was awarded one of the Presidential Medals of Science because of the importance of this work. And the Keeling Curve, the one that we're seeing here, has two features. First of all is the inexorable increase as carbon dioxide concentrations increase in the atmosphere. But closer examination of that curve shows that it has a periodic character to it, with a peak in carbon dioxide concentrations that occur in early spring, followed by a slight decrease in the CO2 concentration, followed by a rise. And what's thought to be happening here is that in the northern hemisphere in the spring, guess what happens? Leaves come out on plants, there's growth spurts of plants, crops are planted, and things are growing, and photosynthesis is trapping carbon dioxide. When the growing season ends, CO2 levels start rising again. Now, the story doesn't end here, because Keeling's son was also an atmospheric chemist, and he tackled a more difficult problem, that is measuring small changes in the concentration of oxygen in the atmosphere. And technically, this is a very much more difficult problem because there's huge amounts of oxygen in the atmosphere already. Although we have way too much CO2, the actual concentration is much, much lower than the concentration of oxygen. So being able to measure accurately a tiny, tiny concentration difference in oxygen is a much more difficult problem. Now, those of you who have taken chemistry know that that you make CO2 by taking an atom of carbon and combining it with 2 atoms of oxygen to make CO2, 1 atom of carbon and 2 atoms of oxygen. So that if the laws of conservation of matter are being obeyed, there ought to be a slight dip in the concentration of oxygen that corresponds with the increase in CO2 concentration, and that's exactly what Keeling's son found. So this father-son team made 2 critical observations about global warming and where it's coming from and what it's due to. Now, this slide shows the data from 4 independently acting groups of investigators who've looked at temperature records from measuring stations throughout the Earth. And 3 of these were NOAA, the National Oceanographic and Atmospheric Administration, NASA, and the 3rd group is a group that operates in England. The 4th guy, Muller, who is at Berkeley, was a climate change skeptic, which is not a bad thing. You know, good scientists are always skeptical about results. They're interested in the next experiment. They're interested in having someone else replicate their results. So this questioning of results and data is one of the things that's inherent in good science. So skepticism isn't a bad thing. Denial of climate change, on the other hand, is a completely different story. Well, Professor Muller got funding from the Koch brothers to re-examine the temperature data because he was skeptical that the results were accurate. But lo and behold, he found results as shown by the black line of those four, that the other three were just exactly on the money. And it would have been very interesting to have been a fly on the wall when the Koch brothers saw the results of the funds that they had given to Professor Muller to do this study. So here's four completely different scientific groups that have looked at the same problem and come up with essentially the same answer. And this map shows where temperatures have changed in the Earth, comparing the January 1950 to 1960 decade to the decade that ended in the year 2010. And throughout the northern hemisphere, the average temperature is now about 0.8 of a degree centigrade higher than it used to be. And this is because of the greenhouse gas, the greenhouse effect. Solar energy comes to the Earth about 342 watts per square meter surface. That's about like having 3.5 100 light bulbs turned down. And some of that energy is absorbed at the Earth's surface and re-radiated back out into space as infrared energy. And the greenhouse gases have the property of absorbing some of that energy and then re-radiating it in all directions quite equally. And it's this re-radiation of this infrared or heat energy that's responsible for the greenhouse effect and the global warming that we're experiencing. And this slide shows the concentration for the last 2,000 years of the three most important greenhouse gases: carbon dioxide, methane, and parenthetically, substantial amounts of methane are released during coal mining processes, and nitrous oxide. Now, the fossil atmospheric record for carbon dioxide actually extends back almost 435,000 years. And there are small bubbles of air that have been trapped in ice samples that can be retrieved by drilling cores of ice samples in glaciers in Antarctica and in the northern hemisphere. And the scientists who analyzed those samples have found that the highest CO2 concentration is just barely over 300 parts per million for the last 435,000 years. So we're approaching 400 at the present time and are poised to achieve that or pass that in the near future unless something drastic is done. So although the climate change deniers will tell you that indeed there have been periods of warming in the past, that's true, but they haven't been as drastic and they haven't occurred as rapidly as they're occurring now. And yes, there have been peaks of CO2 concentration, and there are 4 major peaks that have occurred in the last 400,000 years, but none of them have been associated with CO2 concentrations of the magnitude that we're dealing with at the present time. So this is an unprecedented situation that began at the time of the Industrial Revolution, when we began burning fossil fuels to fuel the industries that have made modern civilization what it is. Now, where is this carbon dioxide coming from? As we heard earlier, huge amounts of it are come from burning coal, and China is responsible for injecting about 30 trillion metric tons of carbon dioxide into the atmosphere every year. Now, you will hear from proponents of carbon capture and storage technology that this is the way, the safe pathway to the future where we can sort of have our cake and eat it at the same time by burning large amounts of fossil fuels, particularly coal, without contaminating the environment with large amounts of CO2. Well, this presumes that we're able to trap 30 to 40 trillion tons of carbon dioxide per year, liquefy it, send it through pipelines that don't exist yet that are likely to burst and cause death and disease because of the exposure to the carbon dioxide that would come from them. And then somehow these 30 or plus trillion tons of carbon dioxide have to be stored essentially for all time, because if this carbon dioxide ever comes back to the surface again, it defeats the whole purpose of the carbon capture and storage in the first place. It's possible that this could happen, but I'm skeptical. I'm a skeptic. I might be wrong, and it's reasonable to do the research to find out whether this, in fact, is likely to happen. Now, one of the reasons why the coal industry is so keen on doing this is that this is going to be a very energy-intense process, so that something like 30 to 40% of all of the energy from a coal-fired power plant that uses carbon capture and storage techniques would be consumed by the carbon capture and storage process itself. So that means, you know, they mine more coal, they burn more coal, they make more profits, and that's why they're enthusiastic about it. None of these processes are likely to be 100% effective either. 80 to 90% maybe, and 80 to 90% of 30 trillion tons per year may not be good enough to avoid the increases in carbon dioxide concentration that we're seeing in the atmosphere. Now, I mentioned severe weather events, and drought is one of them, and this is a map from the end of August last summer that shows the severity of drought in various parts of the United States. It was particularly severe in the central parts of the U.S., but my state, New York, and yours, Montana, were not immune to this drought. And one of the consequences of this was that there were fairly widespread crop failures. And a report issued by the World Bank last summer indicated that the world food prices rose by about 10% in the month of July alone. So just think of that. 10% increase in the price of commodities like corn, wheat, soybeans, the major food sources in the world, in just a single month due to the drought that was taking place in the United States. And that's going to have important implications worldwide because we supply food to a lot of the world. And in another report from the World Bank, they showed that malnutrition, particularly in countries close to the equator among children, already approaches close to 50% in many of those countries. So what's going to happen in those countries when food prices get higher? Well, food prices are higher because there's less food available, and that drives the price up. So the implication is that these conditions of malnutrition, particularly among kids, are going to get worse if droughts continue. And there are other data that show that crop yields have been adversely affected by temperature increases in the last decade or so. Heat waves, such as the one that took place 10 years ago in Europe, are likely to become more common, and we've had severe heat waves in the United States. This one is estimated to have taken 50,000 lives. Diseases like West Nile virus, dengue, hantavirus are likely to become more common as the insect vectors that carry these viruses and diseases expand in their territory as temperatures change. Diarrheal diseases such as cholera and typhoid are likely to become more common as well. Sea levels will increase, and by the year 2050, the IPCC working group, that's the group that along with Vice President Gore were awarded the Nobel Prize for Peace because of their work on climate change. They estimate that in the Nile River Delta, the Ganges, Brahmaputra, and the Mekong River Delta, 1 million or more people will be subjected to environmental refugee status because of rising sea levels. Now let me finish up the hour by talking a bit about the Clean Air Act. That was passed during the administration of Richard Nixon. The most significant amendments to the Clean Air Act were passed in 1990, and this is in part what's known as the acid rain program that was designed to curtail emissions of oxides of nitrogen and sulfur. This gave EPA the authority to regulate point sources like power plants and mobile sources such as cars and trucks that produce pollutants. And the Clean Air Act is one of the public health success stories of the greatest importance in the last 50 years. This shows that the amount of oxides of sulfur and nitrogen really are decreasing substantially, but there's still a long ways to go, and there's still great effects of diseases that are being caused by these pollutants. Among the provisions of the Clean Air Act is the requirement that the EPA make periodic reports to Congress, and hence the American people, about the cost of adhering to the regulations promulgated by EPA and the benefits in terms of health. And the mission of EPA is to protect health and the environment. And these are data from the most recent of these analyses. And EPA predicts that by the year 2020, the savings in terms of healthcare costs, and I'll show you some specifics about that in a minute, are estimated to be on the order of $2 trillion per year at a cost to the industries that need to comply with the Clean Air Act provisions of about $65 billion per year. Now that's a terrific return on the dollar. You spend $65 billion and you get back $2 trillion. So I refer to this as a win-win-win situation. First of all, you and I, our children, our grandchildren, are winners because we have cleaner, healthier air to breathe, and our disease burden is going to be reduced as a result of that. The second win comes in terms of reductions in the cost of health care. You know, we spend a huge amount of money in the United States on health care, and if we can save $1 trillion here and $1 trillion there, pretty soon it adds up to real money. And finally, it's hard to hear anything coming out of Washington, D.C. that doesn't have something to do with one of two topics, the debt or jobs. And since a great deal of the costs of health care are borne by the federal government in the Medicare program, of which I've been a beneficiary, thank you very much, as have many of you in the room, no doubt, and hopefully all of you in the room will at some point in time, and the Medicaid program, which is also financed in part by the federal government, and also states like Montana make substantial contributions to that. So it's a win-win-win situation. We get better health, we get reduced health care costs, and it's a way to control the expenditure of dollars that are in too short supply in both the state and federal governments. And these improvements in the budget come from some of the numbers that are shown, which is these data are also taken from that same report. 230,000 fewer premature deaths per year. 17 million fewer lost days at work. So people don't show up at work, don't do their job. There's an economic cost associated with that. Almost 2.5 million fewer exacerbations of asthma. 200,000 fewer myocardial infarcts. And the numbers go on. And this is health, you know, Dr. Milan and other healthcare professionals who may be in the room tonight and that I'll be talking to tomorrow morning see these as patients that we take care of in our offices and emergency rooms and on the wards of our hospitals. Healthcare economists see these as dollars and cents, and they can take each of these conditions and monetize it and convert that into a healthcare cost saving. So what do we do to deal with this problem? We clearly need a more sustainable energy future. We need to improve the efficiency with which we use energy, and over 40% of the energy that we produce already is wasted and is not used for an appropriate end. We need to use more renewable sources of energy. We need to learn how to take better advantage of both wind and solar energy. And I don't mean just putting up more solar panels. I mean going the next generation of solar-powered energy, artificial photosynthesis, and making hydrogen and oxygen from sunlight using appropriate catalysts. Now the naysayers about solar energy will say, well, when the sun's not shining, there's no energy from that. Well, if you're able to convert that sunlight into hydrogen and then burn that hydrogen at night to make water again, you know, you may have solved the problem. And so those are the kinds of things that we need to support. And we need to do that by supporting education, both at the elementary and college and graduate level, because that's where the scientists of the future will come from. And we need to support the research that's necessary to generate these sustainable forms of energy. We can't continue to rely on burning fossil fuels. They're poisoning the atmosphere that we breathe, and there's a finite supply of them. So sooner or later, we're going to run out of fossil fuels, or in 150 or 200 years, people will look back and say, those silly people who lived in 2013, they actually burned coal and oil to make heat and to make their cars move around. You know, that hopefully by then, those forms of energy will be non-existent. Now, we have a rich supply of solar energy in the United States, and there are estimates that are over 10,000 times as much solar energy comes to the Earth every year as we need to maintain the present energy supply. So we don't have to get very efficient at trapping solar energy and making use of it to fulfill our energy needs. And something less drastic, but also important, close to 80 times as much energy as we use each year is present in the winds that blow across the country, absolutely free of charge. And Montana has many sites where wind farms and turbines can be located to capture that energy. So let me give you something to think about before we have a Q&A period here. There are things that you can and should be doing. And I appreciate the fact that you came here tonight to hopefully become better informed about these issues. But during the course of this week, when I've been in Billings, Bozeman, Helena, and now in Missoula, I've met with a variety of people like you, but also some of the staff from your elected officials. Both Senators Baucus and Tester have staff that want to hear from you. They want to know what you want them as their employers to do so that they can have the ammunition that they need and want to be able to take courageous stands in Congress so that they can do the right thing for a sustainable energy future and a safer country. Speak to your friends and your colleagues, the people you work with, and finally, join and support organizations like mine, Physicians for Social Responsibility, and the many other good organizations that are working as hard as we can to see to it that the dreams that I've talked to you about tonight actually come true. Let me close with a photograph of our house in Buffalo. We have a photovoltaic array that generates about 80% of all of the electricity that we use. Yes, even though it snows occasionally in Buffalo, we still generate 80% of the electricity that we need. We drive energy-efficient cars, and we're converting our lights to light-emitting diodes when the compact fluorescents burn out. So again, thank you all very much for coming tonight. I appreciate your having taken time and made the effort to come. I know there are many other things that you could be doing, and I would welcome your questions. Thanks very much. No questions? Well, we can all go home. Yes, ma'am.
You know, if the American Medical Association has taken a position on demanding phasing out of coal or something?
You know, I'm not sure about phasing out of coal, but as Dr. Milan said in the introduction, our professional societies are saying, you know, get out of your exam rooms and exert the part of your professionalism that's involved with public education and even at the risk of political action.
And certainly the American Lung Association is taking a very strong stand, and the American Medical Association is taking a very strong stand as far as climate change, of which we know coal is very much an actor.
I wish I could say that the same for the American Neurological Association and the American Academy of Neurology, but as yet they have not. Yes, sir.
So where's all the clean coal that they talk about?
Beats me. I think it's in the well,
It's like,
man, that deserves a serious answer. First of all, I find it an anathema that people talk about clean coal under circumstances when burning coal is killing tens of thousands of Americans every year. The expression had its origin decades ago when coal mines began washing the coal that came out of the mines to get rid of the rock and the dirt that was there to make it cheaper to ship. But more recently, that's been mutated into carbon capture and storage technology aspirations and the application of emission control systems to existing power plants and new power plants that are being built. So they are cleaner than they were before. And in October of last year, I was in Kosovo, where they have 2 power plants that burn lignite, which is the very worst form of coal that there is. And some of those boilers have absolutely no pollution control devices on them at all. And you could see this, horrid brown smoke coming out of the stacks. And when I got off the plane, the air reeked of burning coal. And the reason I was there is because the World Bank is being asked to finance the construction of a 3rd power plant. And I was there sort of on a mission from the Bank Information Center to touch bases with Kosovar healthcare professionals and citizens and members of the government. And then when I got back, I had a series of meetings with congressional staffers who are on committees that have a relationship with the World Bank and people from the bank. So they're probably going to go ahead and do it. But one of our pleas was similar to the same kinds of pleas that I've heard here. We need to do a health impact assessment of this new power plant if it's going to be built, just as there is a need for a health impact assessment that's associated with the envision or the plans for shipping large amounts of coal from Powder River Basin to ports on the Pacific Northwest. So I answered a little bit more than your question, but thanks. Yes, ma'am.
Has there been any study done on what can be considered localized energy development, where each locality looks at what resources it has within its own region? Right now, we're looking at wind energy in Montana being shipped to the Sun Belt. It just doesn't make sense to me.
Well, there are lots of those kinds of initiatives all over, and there are communities that have community regulations, and there are small communities, some of which are living completely off of the grid, so to speak. There was a feature story in the New York Times about a week ago about several communities in Ithaca, New York, where I went to school and where my daughter and her family live, about communities called Eco Village, which is sort of a self-explanatory thing. Other larger communities like the state of California now are beginning to control carbon with a cap and trade strategy. And as I can't remember whether Dr. Mylan said this in her introduction, but the government officials in China are talking about a carbon tax on carbon in China. So there are lots of things that are happening all over, but our elected officials in this country need a push to move in the right direction.
Dr. Lockwood, thank you so much for talking to our elected officials. I think it helped to hear from you.
It would have helped more if I'd been one of their constituents, but I was there with constituents.
I have a comment, and maybe you have a reaction to it, someone else might. But the American Rifle Association has 4 million members, and according to a recent study, approximately 40 million Americans are seriously concerned about climate change. The Rifle Association seems to have good generals, and those of us who are in this room have a hard time getting organized to get our voices heard. I don't know where that leaves us. maybe looking for a general.
Let me introduce you to General Milan. And a number of her lieutenants are sitting there in the in the back rows. Now, I really appreciate the opportunity to be here, but if anything that I've done during the week or so that I've been in Montana is going to have any staying power, it's going to be due to people like Dr. Milan and the people that she works with. It's just so important for you to get together, join forces here, form coalitions, particularly on the rail transport issue with the folks in Washington State, Oregon State, Alaska, and probably British Columbia as well, where the threat of having 150 million tons of coal pass through their community every year on coal trains looms very close on the horizon. Yes, way in the back. Hopefully you could hear.
Yeah, absolutely. I would be really excited to learn more about the physiology of how the particulate matter is increasing stroke or increasing those arrhythmias. Can you recommend any literature to try to develop?
There's a chapter in the book about that. It's very complicated physiology that has to do. Are you a biochemistry student or?
I'm in a biochemistry class.
Great. I'm still a student of biochemistry myself. But it has to do with inflammatory responses, oxygen-free radicals, and the effects that those have on organ systems. It's a very complicated business, and just to say, oxidative stress and inflammation oversimplifies the issue a great deal. But at least in the book, which if you should be so moved to buy it, I would urge you to go to your independent bookstore and ask them to order it for you. Apparently, they had some copies, and the one I held up here, I'm told, was the last one they had in stock. But I'm sure they'd be happy to order more, or you can get it from the usual suspects. And it's available in electronic form. And as I showed, I think in the second slide, any and all royalties that come from the sale of the book go to Physicians for Social Responsibility. So here's a chance to become informed and to support my organization at the same time. So thanks for the opportunity to plug the book. Yes?
So one thing I'm hearing that people can do is get engaged with policy and, organizing on that end of things. As a resident of the north side of Missoula, my house is triangulated between railroad tracks, a Superfund site, and a freeway. And I'd like to garden. And so I kind of have questions about what citizens can do in the meantime while we're asking questions, trying to push for change. Is there ways to test our own soil? Are there organizations in other communities that are empowering citizens to find out what their risks are just right now?
I don't know the answer to those local questions. I could tell you in New York State that you could go to some of the laboratories that are operated in conjunction with the state by Cornell University, which is a land-grant college, the College of Agriculture. Perhaps Dr. Milan or some of the other people in the audience have more specific information about that.
Yeah, I was just curious if there's even activism on that level, like informing citizens how to...
I'm sure there is, because one of the groups of people that's at risk because of all of this are the organic farmers. And it's very difficult to get certification as an organic farm. And if trains go by and spew all kinds of pollutants onto their fields, they're at risk for losing their status. So there's likely to be organization. I just don't know who they are. But start with your county agricultural department or the state agricultural department. Yes, sir.
Perhaps I noticed that you talked a little bit about West Nile virus becoming more common and so on, but are new diseases becoming more common in the sense of mutation rates and so on with the elevated temperature? You would think with radiation that, you know, viruses, bacteria, other small organisms, that their mutation rates might change. We might be encountering a whole new suite of diseases. Is there any evidence associated with that global warming?
I don't know the answer to that question, but it's an intriguing one. There are certainly variations in, for example, influenza, which is why you need to get a flu shot every year. But I don't know the specific answer to the question that you pose. Interesting one, though. Yes, ma'am.
Short question. Would you suggest a location or website to get a copy of that fine map that shows the plume of carbon dioxide and other pollutants, which is headed straight to Montana as far as I can see?
That was a mercury plume, right? And
exactly.
that came from the United Nations Environmental Program Global Mercury Assessment that was published in 2008, and that's available online.
UN Global Mercury.
Yeah.
Thank you.
Yes, ma'am.
Where I want to go with this, but the family that owns the trains that will be carrying the coal and that owns the Berkeley pit and probably a lot of others, they live right here in New York. And there will be some.
Do you need Washington's family?
And I just, you know, I mean, at some point, we need to speak to our neighbors.
We need to speak to our neighbors, particularly the ones who own BNSF, right? Yeah.
Do you ever get a chance to give this talk to the coal industry?
Well, there were about 30 or 40 people from the coal industry in the audience in Billings, and what was it, last night or the night before? It's beginning to blur in my mind. There were, I guess last night there was somebody from the Boiler Welders Union who was in the audience. Yeah, so, and when I was in Alaska, one of the talks that I gave, there was a whole row of people that were wearing suits that were in the back row, and I was told they were all from the coal mining industry. So those people know this stuff, but they're the same ones who pay for the ads for clean coal that you're likely to see on television.
Just like the secret.
Yes? I'm pretty sure there was a study at some point that said that the dust emitted from the coal trains, they supposedly did a study that said the dust was no different than dust from any other train. And I just wanted to know what you knew about that, or it doesn't seem to make sense to me. But
I think your intuition is good. And, you know, maybe to give them the benefit of the doubt, the diesel exhaust particles that come from the diesel electric locomotives from a coal train are the same as the DEPs that come from the trains that carry grain or petroleum products or any other commodity, including passengers. But the dust that comes from the coal itself is going to be quite different. And
you have studies that have looked at that in the ambient air or the surrounding community where you down, like you were talking about from the organic farmers.
Apparently, the fugitive losses of coal from coal train studies have been done, but it's my understanding that that's confidential business information, and they haven't released it to the public. And that probably tells you something, because if the number was 0 or close to 0, they'd probably be advertising it.
And I guess my other question is why don't they just cover those? I mean, ideally we wouldn't be transporting it or using it or anything.
Right. Well, they They do spray it, the tops of the trains, with a surfactant that's designed to minimize fugitive loss of dust. But one of the characteristics of the Powder River Basin coal is that it's fairly fragile. So as it gets jostled around in the cars, as the farther it goes, the more jostling and the more of particles there are. And also, the subbituminous coal that comes from the Powder River Basin is subject to spontaneous combustion under certain conditions, so that if you cover it over, the risk of the train catching on fire goes up, which is a bad thing. Well, maybe this is a good time to quit. I'm happy to stick around for a while and answer any other questions. Again, thank you all so much for coming this evening, and don't forget, to speak to your legislators.